This is Stefan Schmidt for InsiderIowa.com. We're here at Iowa State University today doing some work on health care reform. Now, we've heard a lot about the national health care reform process and how complicated it is, how President Obama and Congress have been struggling to try and pass some legislation at the national level that would provide better coverage and coverage for people who are not protected by any health care insurance currently, and also to try to contain costs. You may not know that there is a discussion going on in Iowa as well over this issue, and as you know, let me remind you, the state of Massachusetts, under a Republican governor, Governor Mitt Romney, actually passed a universal health care program for the state of Massachusetts, which requires everyone in the state, almost everyone, to buy some level of health insurance to get some level of health coverage. And there are all kinds of options and all kinds of programs, beginning with very modest and inexpensive ones to more elaborate ones. And that program has been very successful, even though they haven't been able to control costs. But people in Massachusetts, by and large, are extremely happy and supportive of it. The state of Maine also passed a very substantial health care program that provides coverage, and again, is working quite well, and they are now working on phase 2 in both of those states, which is controlling escalating costs. Iowa is also discussing whether we need to step up to the plate and not just sit and wait for the federal government to enact legislation. And there are many interest groups and many legislators in the State House who are exploring legislation to try and advance health care coverage in the state of Iowa. It is an intriguing idea, an interesting idea. Most people in Iowa would be, I think, surprised how necessary it is to begin to deal with this issue, because just this week I talked with several people. One of them went to the pharmacy to get a prescription filled and discovered, without having been notified at all, that he was no longer covered for a fairly expensive medication, so he hadn't been able to prepare for it. His insurance company simply wouldn't cover him for that anymore, and it was a big shock. Talked to another person who, when their health care coverage was renewed, suddenly looked at the health insurance card and realized that their co-payments had doubled in costs. So they are now paying twice as much in co-payments for physician visits. And again, it was somewhat of a surprise, and it is not uncommon to hear from people in Iowa that they have been denied health care, that there are more demands on their own personal budgets, even if they have very good insurance programs, in terms of paying for things. And the other thing people probably don't realize is that if you travel somewhere and you have some health insurance in Iowa, and you become ill or have an accident, you have to be very careful, because even though it may be a very well-known health insurance company, the companies operate state by state. And if you are in, let's say, Illinois, and you go to Chicago, and all of a sudden you have an accident and you go to an emergency room or a hospital, they may not accept all of the coverage there that you would get if you went into an emergency room in Iowa with your Iowa policy. So we all, I think, find health insurance necessary, and health care very critical to our happiness and the quality of our lives. And as the drama unfolds in Washington, I just wanted to tell you to stay tuned here at InsiderIowa.com, because we are going to try to get a little more insight, probably in a couple of weeks, from some of our friends in the Iowa legislature in terms of what they are discussing for potential healthcare reform in Iowa. So stay tuned to InsiderIowa.com for an update on that. This is Stefan Schmidt.